Dean and Tyler Listle are registered investment advisor representatives. Investment advisory services offered through Brokers International Financial Services, LLC, member SIPC. Brokers International Financial Services, LLC, and Secure Retirement Solutions, LLC are not affiliated companies.
It's time for Secure Retirement Solutions with your hosts, Dean and Tyler Listle, fully licensed retirement specialists from Secure Retirement Solutions in Green Bay. Now, here are your hosts, Dean and Tyler.
Good morning, and thank you for joining us today. Tyler and I will discuss topics that affect your retirement, such as investments, income planning, Social Security, and much more. How are you this morning, Tyler?
Good morning, Dean. I'm doing great. How about yourself?
Good, thank you. Today we're going to talk about Medicare Basics. We're smack dab in the middle of the open enrollment period, which runs between October 15th and December 7th. And people have so many questions as it relates to Medicare. So we're going to talk the basics. First of all, understand, though, that Tyler and I do not work for Medicare or Social Security. However, it's a major part of the retirement planning process. That's why we have agents in our office who do take care of Medicare supplements and Advantage plans for our clients. So talking about the basics here, we're going to talk about what is Medicare. We're going to talk about Part A, Part B. We're going to talk about supplements and Advantage plans. But basically, Medicare is for those people 65 and older that help take care of their hospital and or basic medical needs. However, there are some gaps in the system, and that's where you come up with a supplement or an Advantage plan that we'll be talking about. And there are significant differences between those two. So, Tyler, let's just talk about the basics. Who qualifies for Medicare, and what's, we hear about Medicaid too. What is the difference?
Yep. So right now we have, we're right in the middle of annual enrollment, which for people who are on Medicare, that would be October 15th through December 7th every year. So every year, sometime between those dates, we usually do our Medicare show, and that happens to be this week. And reason that we find it so important is because we have a lot of our clients who are currently on Medicare, and if they're not currently on Medicare, they will be at some point in the future. So it's going to affect everyone. And Medicare, it's federal health insurance for people in the U.S. ages 65 or older, or younger than that if you're disabled. And Medicare, now that's what most people have, but oftentimes we hear people when they come into our office, they get Medicare confused with Medicaid. And Medicaid is for those people who are poverty-stricken or they have low income. They can potentially qualify for Medicaid, which is different than Medicare. So again, right now, people who are 65 or older and on a Medicare plan or enrolling into Medicare, we're in the annual open enrollment period, which runs from October 15th through December 7th. And during that open enrollment, those who are on Medicare can choose to reevaluate their Medicare Advantage plan or their Medicare Part D plan to see if they can potentially get better benefits or a cheaper price. So as we get into the show today, we're going to break down the difference between each of those and the different parts of Medicare. But really right now, whether you have a Medicare Advantage plan or a Medicare supplement, it affects you either way, because with a Medicare Advantage plan, you can reevaluate that, or a Medicare supplement comes with something called Part D for prescription drugs, and you can evaluate that during this period too. So it's going to apply to you no matter what type of plan you have if you're on Medicare right now. Now, if you do switch plans during open enrollment and go on to a new Advantage plan or Part D prescription drug plan, then your new coverage begins on January 1st. So right now, people who we have into our office who are open enrolling right now, they are changing different plans, but it's important to know that your coverage will then start on January 1st for the new year in 2020. And then in 2020, you're going to have to go through the same process again between October 15th and December 7th. Some people find it a little bit tedious, but it is very important because, again, you can either get better benefits or a cheaper price or a combination of both. And many people, they don't realize it, but whether it's less expensive medications, saving money, or keeping your doctor in network, or just finding a higher quality plan overall, it's worth the time to simply come in and reevaluate your options with a Medicare agent. Dean, as you said, we have them right here in our office here. But whether it's our office or somewhere else, if you're on Medicare, it's very important during this time period to see an agent and reevaluate what your options are.
Yeah, we recommend that every year. If you're working with an agent that doesn't get together with you to review things on an annual basis, especially during open enrollment, you should probably find another agent. And the reason I say that is, excuse me, especially with Part D, when it comes to a Medicare supplement, a lot of your drug coverage falls out of favor with certain pharmacies. So, for instance, you could have a drug coverage under your Part D, and your preferred provider could be, let's say, Walgreens, who gives you, very nice pricing, some of the best pricing on your Part D, only to find out the following year, it seems like your medications go up. First thing is most people want to put blame on the pharmacy companies, but many times it is the pharmacy itself that has no longer preferred provider status with certain medications. So therefore, instead of, hypothetically Walgreens, you could find out that Costco might be your better place to go. So we recommend, if you have a Medicare Advantage plan or a supplement, get together with your agent, have a review annually during open enrollment to see if you're still in the best Part D supplement or Advantage plan you should be in. Okay, now we're going to talk about the basics of the parts. Part A would be the one that most people are familiar with. In Part A, a quick summary here is Part A takes care of your hospitalization. So it takes care of those catastrophic things, so should something happen to you. Part A is the one that people always refer to as a freebie. They feel like they're not paying for it at all. And typically 3 months prior to your 65th birthday, you go and sign up for Part A. If you're already on Social Security, though, sometime prior to 65, your Part A is already taken care of when you sign up for Social Security. But Part A takes care of the catastrophic things that are in place. Again, people refer to it as the free one. I'm not paying for it. You actually did all your life as it came out of your payroll. Tyler, what else, when we're looking at Part A, should people be aware of other than having to sign up prior to 65 years old, whether they're working or not?
Yep, so in addition to the open enrollment period, we're going to get a little bit deeper into Medicare, each of the parts, and the first one to start at would be Part A, where, as you mentioned, Dean, what it is in basic terms is inpatient care in a hospital, so it's considered by some as hospital insurance. It is free, and we encourage most people to go to the Social Security Administration and sign up for Part A before they turn 65 years old, within that window, regardless if they're working or not, because it's free even if they're covered through their employer at work. So even if you are working, go ahead and sign up for Part A. Now, in order to sign up for Part A, you do have a 7-month window to sign up, and that starts 3 months before the month you turn 65. It includes the month you turn 65 and ends 3 months after you turn 65. So there's an initial 7-month window around your 65th birthday to sign up for Part A. And if you miss any of those initial 7 months, and you have between January 1st and March 31st each year to sign up during the general enrollment period.
Okay, and as Tyler said, he referred to Part A as being free. What we mean by that is there's no fee to sign up for Part A. You don't have any deductions on your Social Security. So from that standpoint, but again, you did pay for it all your life as it came out of your payroll, but there is no fee to sign up for that Part A. Ty, what about, we hear from people talking about HSAs as it relates to their Part A.
Yeah, and that's the one time that we do not encourage people to sign up for Part A during their initial 7-month enrollment period. Reason being is, if you have an HSA that's a health savings account through work, and health savings accounts can be beneficial, and they're becoming a lot more popular as opposed to in the past. So we see many more people coming in that have HSAs, and they're continuing to contribute to their HSA rate up until retirement. And if you're currently contributing to an HSA through your employer and you sign up for Part A, you can no longer contribute to your HSA anymore. So if you want to work past Medicare age, past age 65, and you're covered through work yet, and you're contributing to your HSA, and you want to continue to contribute until you retire, then you don't want to sign up for Part A until you retire. because again, if you do any earlier than that, if you sign up for Part A earlier, then you can no longer contribute to your HSA through work. So it's important that you actually don't sign up if you do want to continue contributing to your HSA. But the basics with Medicare Part A is that it's considered hospital insurance. You don't pay a premium or a fee for that once you get it or once you're receiving it. Dean, as you said, you paid for that your whole life. But Part A, it covers the different inpatient care, skilled nursing care, hospice care, different hospital services.
Okay. Now we're going to talk about Medicare Part B. This is the one that people do notice comes out of either their Social Security benefit or they're billed for it. So Part B is really for preventative services or your doctor visit. So Part A is put in place for hospitalization and catastrophic. Part B, you do have to pay for that. The government has Part B in place. That's for, again, preventative services or doctor visits. Now, if you're drawing Social Security already prior to retiring, what happens is you retire, and at that point you might no longer qualify for group health. You're 65 or older, so you now have to sign up for Part B. Part B happens after you leave your group health insurance and you're 65 or older. So Part B then is going to either come from your Social Security benefit. Every month it'll come out of there as a deduction. You'll see that. Or if you're not drawing Social Security after 65 and you're having to get Medicare, you will be billed on a quarterly basis. So you will be billed and it'll take care of the upcoming 3 months. So it's a 3-month time span that they bill you for. So Part B is mandated by the government that takes the money either directly from your Social Security benefit, or if you're not on Social Security but you are on Medicare, then they will bill you forward billing, meaning you pay today for the next 3 months coming up. Tyler, what else about Part B?
Yep, so as you mentioned, Dean, Part B is the one that does have a cost to it. For most people, it costs right around $135 per month, and it comes right out of your Social Security benefit if you are receiving Social Security. If you're not, you're billed that $135. But some people with higher incomes, you might pay more than the $135 per month, as it can range from $189 per month all the way up to $460 per month, depending on your income level. But for many people, it's going to be right around the $135 per month, taken right out of your Social Security payment if you are receiving Social Security. And with that said, it's not recommended to sign up for Part B if you're older than 65 and still covered under your employer, because once you retire, then you want to make sure that you sign up for Part B. And the reason why you wouldn't want to sign up for Part B earlier is because, again, you're paying for it then. Where Part A, you can sign up for if you're still employed, if you're still covered under your employer plan, because you don't have to pay for it. You don't pay any premium or anything after you receive it. Whereas Part B, you do pay that, and it does come out of your Social Security. So again, if you're older than 65 and still covered under your employer plan, you can sign up for Part A, but probably don't want to sign up for Part B, because then you're going to pay a premium there, plus the health insurance that's deducted from your payroll as well. So that's something where once you do retire, then you're going to want to sign up for Part B and either a supplement or advantage plan. But more importantly is that together, Part A and Part B only cover about 80% of your total healthcare costs. So that's something that many people don't realize, and we've had people come in and they said, well, if I get Medicare Part A and Part B, I'll be just fine. But if you do, it's going to leave a gap of about 20% that you'll have to pay on your own for medical expenses. So, we see people all the time that they'll come in and having a surgery that costs $100,000 is not uncommon at all anymore. And if you only have Part A and Part B, it's pretty tough to stomach paying $20,000 out of your own pocket when you could easily avoid that. So Medicare Part A and Part B cover about 80%. That 20% gap you would have to pay on your own unless you get either a Medicare supplement or a Medicare Advantage plan to cover the remainder, which is highly recommended. And we're going to get into both of those in just a minute here. But again, to summarize, Medicare Part B, you do pay a premium for it. It comes right out of your Social Security, or if you're not getting Social Security, you will get billed that. And it covers different outpatient medical services, preventative services, doctor visits, lab testing, different things like that.
Okay, before we talk about Medicare supplements and Advantage plans, we're going to take a quick break.
You're listening to Dean and Tyler Listle, investment advisors with Secure Retirement Solutions located on Allied Street in Green Bay. For a complimentary review of your current investments, or if you have questions, please call them at 920-347-9888 or go to their website at srsplans.com.
Okay, now we're going to talk about, as Tyler said, if you have Part A and Part B in place, you still have about 20% of your medical needs that won't be covered. So Part A and Part B take care of 80% of your needs once you're 65 and older and on Medicare, or 65 and younger if you're on disability, you qualify. Now let's talk about how do we fill that 20% gap. You typically have two options here. Many people aren't aware of this, but there are two different types of gap coverage that you can get. And that gap coverage covers that 20%. One would be a Medicare supplement, and the other would be a Medicare Advantage plan. Let's talk about a Medicare supplement, which is a little bit more traditional, been around longer. And this is a situation that is sort of like health insurance in that you pay a premium each and every month. Whether you use it or not, you're going to pay a premium. You also pay for a Part D. D is in drug coverage. So you pay a premium to receive your supplement, and then you also pay a Part D. So it's more of a conventional situation, a lot like health insurance in that you pay each and every month whether you use it or not. However, typically it is cheaper than most health insurance options unless you are on low income and receive significant subsidies on your insurance. But typically, people who are retiring from group health many times do like to see a supplement or Advantage plan come up as opposed to their group health that they've been on at work based on the amount that's coming out of their payroll to pay for that. The other advantage that people really like when it comes to Medicare supplements, many times you have no deductible or a very low deductible. So people who have an $8,000 or $5,000 or $13,000 deductible plan for health insurance, when they go on Medicare, many times they get a plan that has no deductible, which is absolutely wonderful. You get into a situation where you have a major surgery and you never see a bill. So those are some of the things you need to talk to your agent about. There are no or low deductible plans out there. Tyler, what else about a Medicare supplement? And then we'll talk about Medicare Advantage.
Yep. So again, once you are 65 and no longer covered under your employer health insurance, you have Part A, which covers your hospital stays, Part B, which is different outpatient services, preventative services, doctor visits, and then from there, you're either going to get a Medicare supplement in Part D or an Advantage plan. Now, again, we're touching on the supplement right now, but it fills that 20% gap that Part A and Part B doesn't cover. And as you said, Dean, many people with a supplement, they really like it because even though you pay a monthly premium like traditional health insurance, you typically don't have to pay any or very low deductibles or copays. And in addition to a supplement, you also have to get your prescription drug coverage, but you must first have Medicare Part A and Part B to have a supplement, and a supplement only covers one person. That's another question that we get. Whereas, health insurance, you can go and if one spouse is working at a certain job, both spouses can be covered under that group health plan. But with a supplement, it only covers one person. So if you and your spouse both want one, then you'll each have to buy separate policies. And one thing with a Medicare supplement is that it's very important to make the right decision before you age into Medicare at 65. And what that means is aging in is when you either are 65 or once you no longer are working through your employer plan and you might retire at 67 or 68 or 70, whatever the age is, that is when you age in. Because once you elect a Medicare supplement, you cannot switch to a different one without being underwritten for existing health problems, and you must pass underwriting to switch to a new one. So it's not saying that you can't switch to one at all. It's just saying that you can't switch to one without being underwritten for prior health conditions. So it's very important that you get the decision right the first time, because oftentimes if you don't, you might have some trouble switching later on with a Medicare supplement. So Medicare supplements, we see it often where if people can afford to pay the monthly premium, it definitely works for those who might have different health ailments or who are to the doctors a lot. If you have something going on that requires you to visit a doctor monthly or even a few times a year, well, then it's probably going to be beneficial because you're not paying any deductibles or copays. You're only paying that premium to make it worth those frequent doctor visits. You can, though, however, switch your Part D prescription drug coverage each and every year during the open annual enrollment period, which is what we're in right now. That's what we talked about initially. And we do highly encourage people to do this to see if you can get prescription medications that are cheaper, because right now that's a part where we see a lot of people who are currently on Medicare supplements coming in, and their prescription drugs, they can potentially get a lot cheaper just by either switching pharmacies or switching the drug type. So that's something that you, if you're on a Medicare supplement, you want to do that each and every single year to evaluate your options. But ultimately, the overview of the Medicare supplement is it's a private insurance policy that fills that 20% gap, and Medicare supplements, they oftentimes require you to pay premiums out of pocket, but you usually don't have to pay any or low deductibles or copays. And in addition to a supplement, you also have your Part D prescription drug coverage too. So that's the main breakdown with a Medicare supplement.
Okay, and one other thing to throw in there too, we do hear a lot of confusion when it comes to open enrollment. Some people will say, well, I'm 65 or 66 years old. I do want to retire. I'm going to lose my group health and I qualify for Medicare when I retire. However, I can't retire until the open enrollment period. That's not the case. You have a life-changing event when you retire, so you qualify to go into a Medicare supplement or Advantage plan at any time during the year when you retire and leave your group health. So you don't have to wait for open enrollment for something like that. Just wanted to clear that up. Okay, now the last one we're going to talk about is a Medicare Advantage plan. We talked about a Medicare supplement, more traditional in that you pay a premium every month. You pay for your Part D drug plan. However, with that, many times you will have no or a low deductible. So that was more of a traditional look, and that's a Medicare supplement. A Medicare Advantage plan, many times you'll hear of people say, I pay nothing, or I pay $50 a month. That's all I pay for my Medicare plan. Or I get a gym membership, or I get a Fitbit, or I do have some optical or dental built in. Those are typically Advantage plans. And people are very, people with Advantage plans, they like the fact that it's low out of pocket. So again, your premium could be $0 or it could be upwards of $50, but it's low, and you have many more bells and whistles as far as advantages of taking options with dental or optical or a plan for the gym and so on. So those are some of the things that are built into Advantage plans. With a Medicare supplement, you do not have dental and optical. You have to buy those separately. So the Medicare supplement just takes care of medical needs and your drug. A Medicare Advantage plan does take care of some dental, typically, optical, and again, they do have gym memberships and Fitbits and some of the other bells and whistles that the Medicare supplement doesn't have. However, what does happen with an Advantage plan, you have to understand this, you typically have copays or more significant copays. So if you're not using the Advantage plan and you're healthier than most, that's good. You're not paying a whole lot. But if you get into a significant situation where you do have a lot of maintenance with your Advantage plan, you might not like the amount of copays you're paying. So this is where we sit down and talk to a client individually. We go through a questionnaire to find out what their health history is. Do they travel? What are your needs in retirement when it comes to your health plan? Some people are better suited for an Advantage plan. Some are better suited for a Medicare supplement. Need to talk to your agent about that. If you have some confusion, feel free to give us a call, drop in. We'd be more than happy to take you through a screening to make a recommendation for you. Tyler, what else about the Advantage plan?
Yeah, Dean, when it comes to an Advantage plan, it works like a supplement where it covers that 20% gap in medical expenses that Medicare Part A and Part B don't cover. However, with an Advantage plan, as you mentioned, most either have no monthly premiums or very low monthly premiums that you pay, but they do come with various copays and deductibles. However, many of them do have a maximum out-of-pocket. So those are the main differences between Advantage plans and supplements, where supplement you do pay the monthly premiums, but you don't have any, or you might have very low copays and deductibles. But with an Advantage plan, you either pay no monthly premiums or very low monthly premiums, but then you do have various copays and deductibles that will come out of pocket there. So those are the main differences. With Advantage plans, each and every year during annual open enrollment, which is the period that we're in now, you can go and shop your current plan against others and switch to a new plan without going through any medical underwriting. So that's the other main difference between an Advantage plan and a supplement, whereas if you want to switch supplements, you do have to go through the underwriting process. If you want to switch Advantage plans during this time of year, you don't have to. So that's another big difference there. Whether you want to or not, though, it's recommended to reevaluate your Advantage plan options during open enrollment, because you could switch to a different plan and potentially get either better benefits or a cheaper cost. So we do highly recommend you to sit down and go over your options, because oftentimes people will just ask, what is better, an Advantage plan or a supplement? Well, what's better for you might not be better for someone else. So it all depends. It depends on your own health situation, your financial situation. Just like different investments, what works good for someone, what's a good plan for someone, might not be a better plan for someone else. So the only way to find out is to sit down and evaluate your options. And since we currently are in the open enrollment period, it's important to evaluate. And if you're Medicare age and you haven't already done so, we do have a Medicare agent, Luke Listle, in our office here, and he'd love to help evaluate your options. So our number, 920-347-9888. If you want to give us a call and talk to Luke, he would love to help you out with that.
Okay, that's all the time we have this week. See you later, and hope you'll join us again next week.
We'll see you next week.
You've been listening to Secure Retirement Solutions with your hosts, Dean and Tyler Listle, fully licensed retirement specialists from Secure Retirement Solutions in Green Bay. To get more information from Dean and Tyler, contact them at Secure Retirement Solutions on Allied Street in Green Bay. Call 920-347-9888 or visit them at srsplans.com. Securities and investment advisory services offered through Brokers International Financial Services, LLC. Member SIPC. Brokers International Financial Services is not an affiliated company.